Good afternoon and welcome to the Hawaii State Senate Committee on Health. I'm Senator Jarrett Kehokalole, Chair of the Health Committee. You are here for today's Wednesday, February 16th, 1 p.m. hearing agenda, followed immediately after by our Wednesday, February 16th, 1 p.m. Decision making on SB 2443. This meeting is being streamed live on YouTube. In the unlikely event that we have to abruptly end this hearing due to technical difficulties, the committee will try to reconvene and discuss any outstanding business at 2 p.m. today. Today is a deadline for bills to be passed out of the Health Committee, so we are going to try to get through everything and vote by the end of our allotted hearing time. This is a 90-minute hearing, so that's 2:30 p.m. For testifiers participating remotely, your audio will be muted and video disabled until shortly before it is your turn to testify. Because of the time constraints, you will have 2 minutes to share your testimony. We have all of your written testimony recorded for the record and distributed to the members. I've reviewed every piece of testimony submitted. So I would encourage you to stand on your testimony instead of reading it verbatim, unless you have anything additional you'd like to say or any particular points you think are not would be better reflected in oral testimony versus in writing. If there are temporary technical glitches during your turn, we may have to move on to the next person due to time constraints, but we will try and come back to you to allow you to testify. We appreciate your understanding and apologize if the closed captioning doesn't accurately transcribe your name. If you're interested in reviewing the written testimony, please go to the legislature's website and you will find a link on the status page of the measure you're interested in following. We'll move to the first measure on the agenda, SB 2031, relating to the Office of Health Equity. This establishes the Office of Health Equity within the Department of Health. It also makes an appropriation. Oh, I'm sorry, I forgot to mention. So I'm the chair of the committee. I'm joined here by fellow Health Committee member, Senator Kurt Favela, and also members of the committee who are not in attendance at the moment are my vice chair, Senator Rosalind Baker, Senator Sharon Moriwaki, and Senator Joy San Buenaventura. So first up to testify on SB 2033, Department of Health and Support.
Thank you, Chair Kehokalole and members of the committee. I'm Lola Irvin, representing Director Char for the Department of Health. And the department supports is SB 2031, which would actually statutorily then amend Chapter 321 to formally establish Office of Health Equity in the department. We do defer to the priorities in the executive supplemental budget request. I'm available for any questioning, and you do have the department's testimony, so I will mind the time. Thank you, Chair.
Thank you very much. Hawaii Coalition for Immigrant Rights and Support.
Aloha, Chair and Vice Chair, members of the committee, Liza Ryan Gill, representing more than 25 immigrant serving and immigrant-led organizations. We are in strong support of the establishment of this office in a more permanent way. We began meeting at the beginning of COVID to address these exact issues. And because we saw such a high rate of infection amongst Pacific Islander and limited English proficient communities that need special attention to reestablish trust. So we'll stand by for any questions, but you also have our written testimony. Mahalo.
Thank you very much. Hawaii Public Health Institute in support.
Not present, Chair.
Healthcare Association of Hawaii in support, or with comments.
Thank you. With comments, yes. Well, and we are in support of the measure, and we are very concerned about a lot of the disparities that became, I think, very noticeable during the pandemic, and we just appreciate the opportunity to provide our comments in support of creating a more centralized agency to make sure that all of the correct players are getting together, because it is not just about healthcare, it's about social determinants of health. And we do believe that there is an appropriateness to having this at the Department of Health. So thank you.
Thank you very much. That's all the registered live testimony we have. Is there anyone else on the call who'd like to testify? Okay, seeing none, I'd like to note the written testimony offering comments from the Department of Budget and Finance, and then supporting testimony from the following organizations: Aloha Care, the American Cancer Society Cancer Action Network, the American Heart Association, the HMSA, the Native Hawaiian and Pacific Islander Hawaii COVID-19 Response, Recovery, and Resilience Team, Thaddeus Pham, and Louise Linker. Members, any questions? Okay, we'll move to the next measure, SB 3180, relating to healthcare. This establishes the Rural Health Task Force within the Department of Health to make recommendations on registered nurse recruitment and retention in rural areas of East Maui, Molokai, and Lanai. First up, we have the Department of Health.
Good afternoon. I'm Matthew Shim, Chief of the Family Health Services Division. The department stands on its testimony providing comments, and I'm here to answer any questions. Thank you.
Thank you very much, DHS.
Hi, good afternoon, chairs, members of the committee. I'm Judy Moore-Peterson. I'm the MedQuest Administrator. And on behalf of the Department of Human Services, we stand on a written testimony. We offer comments. We do request an amendment, but overall, we appreciate the measure's intent. Thank you.
Thank you very much. Hawaii State Center for Nursing.
Aloha, good afternoon. My name is Laura Reichart. I'm the director of the Hawaii State Center for Nursing. I just want to mention that the Center for Nursing has provided written comments, and while we have done a considerable amount of work specifically to highlight the needs of nurses in rural communities in particular, and I've listed that in my testimony, I also want to note the complexity of the issue and the challenge. And I think that this is an important measure. However, I also think that the challenge with COVID makes it even more challenging, because we not only have a local nursing workforce shortage, but a local, state, national, and international workforce shortage right now.
Thank you very much, Queens Health System.
Aloha, Chair and Vice Chair. JC Mike Gillick on behalf of Queens Health Systems. Just really appreciate you hearing this measure, as well as the other measures addressing workforce issues on our neighbor islands. As you know, Molokai General Hospital is under the Queens Health Systems, and so we're very aware of the acute importance of this bill and others dealing with workforce. Thank you.
Thank you very much. Is there anyone else on the call who'd like to testify on this measure? Okay, seeing none, we have written testimony from Hana Health in support, the American Nurses Association with comments, the Hawaii Primary Care Association in support, the following individuals and organizations all in support: Liberty Dialysis, Molokai Community Health Center, Faith Tuipulotu, Rosie Davis, Jean Ross Davis, Alice Lee, Chair of the Maui County Council, Courtney Page DiMaggio, Louise Linker, Judith Mikami, Lorna Dudois, and Kamale Davis. Members, any questions? Okay, seeing none, we'll move to the next measure on the agenda, SB 3208, relating to healthcare preceptors. This amends the definition of preceptor and volunteer-based supervised clinical training rotation to improve accessibility for providers to receive income tax credits for acting as preceptors. It also includes the Director of Health on the Preceptor Credit Assurance Committee. Department of Health, first in support.
Good afternoon, Sheriffs. Keohana Kalole, Vice Chair, members of the committee. Lauren Kim for the Department of Health. We are in strong support of this, and we'll stand on our testimony saying such. Thank you.
Thank you very much. Department of Taxation.
Good afternoon, Chair, Vice Chair, and members of the committee. Teresa Zetwick for the Department of Taxation. We stand on our written testimony offering comments and are available for questions. Thank you.
Thank you very much. Hawaii State Center for Nursing in support.
Hi, good afternoon, Chair, Vice Chair. The Center for Nursing is an administrator of this program, and we want to note that while we have had small increases over time, we have been turning away a large number of providers who are doing teaching to our local students, and we want to enable them to access this tax credit and feel the appreciation that you all established in 2018 with this tax credit program.
Thank you very much. Kaiser Permanente in support.
Good afternoon, Chair, Vice Chair. Jonathan Ching for Kaiser Permanente. We'll stand on our written testimony in support of Senate Bill 3208. Thank you.
Thank you. Queens Health Systems.
Aloha, Chair. JC Mike Gillick for Queens Health Systems. We'll stand on our written testimony in strong support of this measure. Thank you.
Thank you very much. Tax Foundation.
Good afternoon, Chair and members of the committee. This is Jade McMillan on behalf of Tax Foundation of Hawaii. We have submitted written comments on the measure. We're going to stand on our comments. Thank you so much.
Thank you very much. That's all the registered testimony I have on this. Is there anyone else? Okay.
Kelly with the University of Hawaii. We will stand on our written, well, I guess you don't have the testimony, but in strong support.
Yeah, you know, I don't have it on my list. So if you can please follow up with our office, let's make sure we get you included in the record. Is there anyone else on the call who would like to testify on this measure, SB 3208? Okay, members, questions? All right, I'd like to note the written testimony offering comments of the Department of Budget and Finance, and then the supporting testimony of the American Nurses Association, Hawaii Pacific Health, Hawaii Primary Care Association, Hawaii Association of Professional Nurses, Kathleen Yokouchi, Ann Scharnhorst, Stephanie Marshall, and Catherine Finn Davis. And since there were no questions, we'll move to the next measure, SB 2128, relating to air pollution. This requires the Department of Health to, consistent with federal law, adopt cost-effective technology feasible regulations to prohibit engine exhaust and evaporative emissions from new small off-engine exhaust and evaporative emissions from new small off-road engines. First up, the Attorney General's office.
Good afternoon, Chair, Vice Chair, members of the committee. Lyle Leonard for the Attorney General's. Nothing further to add beyond the written testimony, but I'm available for questions.
Thank you very much, Mr. Leonard.
Thank you.
AMR in support. Okay, Queens Health Systems in support.
Sorry, Chair, yes, we're standing on our testimony in support. Thank you.
Oh, wait, I got this wrong. I'm sorry. Department of Health in opposition.
Good afternoon, Chair, Vice Chair, and committee members. My name is Marianne Rossio from the Department of Health. The department stands on its written testimony in opposition, and we're here if you have any questions for us. Thank you.
Thank you. We also have opposition testimony for Outdoor Power Equipment Institute and Gerard Silva. And I believe Mr. Mikulanik was confused because I was confused, and it was supporting testimony for another measure. So we won't record Queens as being in on this bill.
Thank you, Chair.
Members, any questions? Okay, we'll move on. SB 2281. This is relating to psychology. This establishes licensure requirements for school psychologists to be administered by the Board of Psychology. It requires all school psychologists to be licensed by July 1st, 2025, and increases the composition of the Board of Psychology to include 2 school psychologists. Department of Education in support.
Good afternoon, Chair Kalole, Vice Chair Baker, and members of the committee. Sean Bacon, Interim Assistant Superintendent for the Office of Talent Management, testifying on behalf of Superintendent Hayashi and the Department of Education. The department stands on its written testimony, providing comments on Senate Bill 2281. We thank you for the opportunity to testify, and I'm here to answer any comments.
Thank you very much. Board of Psychology offering comments.
Good afternoon, Chair K.O. Holole and members of the committee. My name is Christopher Fernandez, Executive Officer of the Hawaii Board of Psychology. The board's legislative committee wishes to stand on its testimony offering comments on this bill. Thank you.
Thank you very much. Hawaii Association of School Psychologists in support.
Hi, my name is Leslie Bonnick. I am the current national delegate to the Hawaii Association of School Psychologists. We stand in support of our written testimony. To a couple of the comments with the Board of Psychology and Hawaii Psych Association, in previous years, they were amenable to us being under the Board of Psychology, given that some of the ones that were using the title of school psychologists were clinical psychologists that could not get their license. If the Board of Psychology and Hawaii Psych Association could please contact us with further questions to understand further why they are not supporting this year when they have in previous years, that would be great. And if the legislature has any questions for us regarding this bill, please feel free to ask. Thank you.
Thank you very much. Next, we have the HSTA in support.
Aloha, Laverne Moore, speaking on behalf of also Tui Jr., President of HSTA. We support this bill. I do want to make a point that, do you realize Hawaii does not allow a nail tech license from another state and will not allow a nail tech to legally conduct business in Hawaii? The individual must take and pass a written exam to obtain a Hawaii nail technician license. Currently, school psychologists are exempt from having to have licensure to practice in the educational setting and have had no credentialing in the state of Hawaii. Hawaii is the only state in the nation that allows this. The Hawaii State Teachers Association asks that you support this bill, especially with COVID-19, the impact it has on our students and the need for school psychologists to be licensed and credentialed. Thank you very much.
Thank you very much. Alec Marantic in support.
Aloha, Chair and committee members. Thank you for this opportunity to testify. I'm a school psychologist on Hawai'i Island for the KKP complex area. I want to echo what was just previously stated, that Hawaii remains the only state in the nation without a school psychologist credential. And a major concern without a proper credential is that parents that have ethical concerns don't currently have a board to bring complaints to. And that leaves our kids vulnerable to malpractice, especially since you do not have to have specific training without a licensure to operate as a school psychologist, at least not training that's outlined by the National Association of School Psychs. The bill as it stands, I would like to see it align with the National Association of School Psychologists credential recommendations, of which it is currently mostly aligned with. Thank you. I stand on my written testimony as well.
Thank you, Dr. Angie Graham in support.
Yes, thank you, and Senate members. I appreciate you taking the time to consider this bill. I do stand by my written testimony. I just want to express how important it is to have a credential or a license for school psychologists in this state. There is a huge liability on myself and other DOE employees and just the state in general, that when a parent asks for my credentials or my licensing, I can't give them anything besides what I brought with me from another state. I understand there isn't right now a process for school psychologists to be licensed or to even go through a program in Hawaii. However, there are a lot of online programs that if the DOE was amenable, we could definitely help some of the school psychologists that are calling themselves school psychologists currently get some training and enough training to be credentialed under this license. Thank you very much.
Thank you very much. That's all the registered in-person testimony I see for this bill. Is there anyone else on the call who would like to testify? Okay, seeing none, I'd like to note for the record, 25 individuals submitted testimony in support, 3 in opposition, and 1 with comments. Members, are there any questions?
Chair, I have a question.
Senator.
Yes, is Christopher Fernandez here with the Board of Psychology?
Hi, Senator. Yes.
Hi, aloha. Question, is the problem, because you've seen this bill before or the request to establish school psychologists. So can you give us any background on what the problem is? I see that the trying to rectify this, putting a couple of psychologists on your board so that there is more knowledge about what a psychologist does in the schools. But as you heard the testimony, there's so much need for that in the schools. I just wanted to know why it hasn't been something that you've addressed previously.
Yes, thank you, Senator. I'd just like to firstly say that the Legislative Committee for the Psychology Board does appreciate the intent to license school psychologists in the state of Hawaii. Currently, the statutes that for the psychologists, 465, have the focus on doctoral level education for clinical counseling, and in fact, actually school psychologists as well. And I think that the specific comments was led to state that the idea of modifying the board's purpose as it stands now maybe beyond that structure.
May I ask a question? It was last time Haas spoke.
Excuse me, this is Q&A between the members. So if Senator Moriwaki has a follow-up for Mr. Fernandez or a direct question for you, then I'll acknowledge.
Yeah, I just wanted to understand why, if this is so important, and as you say, it's important for the board, why the board hasn't addressed this in the past, and why is it coming up again before this body?
Well, I believe it was in not last session, but the session prior in 2020 that the board opposed a bill similar that did place the, I will specify that the school psychologist specialist be added to the licensure underneath 465. And that it was established that that was because that their education and specialization is not something that this specific, the board as it stands right now, is designed to do. But I think that's, sorry, I hope I'm answering your question.
So I don't know if you're the right person to answer this question, but if not you, who? And if licensing of school psychologists is such a specialization, should we not be looking then, do we look at a separate board for licensing, and what would that entail?
Currently, the legislative committee that reviewed this bill did not review the idea or option of a separate program or board. They did state in the testimony that the past testimony they provided suggested following a bill from the 2019 legislative session, SB 818 SD2, which would establish the licensure under the Hawaii Teacher Standards Board, similar to counselors.
Yeah, I guess it confuses me because we would like to have licensed psychologists, and if we heard from the testimony, they need to have their licensure, and if we're the only state that doesn't do it, wouldn't the Board of Psychology be the ones, since these are, I would say, school psychologists would be a specialty or specialization under psychologist. Would it not? I mean, it's just the venue in which you operate, but they have the same qualifications and education as a psychologist, clinical psychologist.
I do not believe so, no. Especially at the school psychologist specialist level.
Okay, thank you, Chair. I think, yeah, it seems that there's a need, but I don't know if, you know, it's actually being addressed at all by the board.
Okay, thank you, Senator Moriwaki. You know, I know there's a lot of vigorous head shaking and nodding going on, but I just can't allow you know, an extended dialogue. Are there any members, you know, once we start that, then we don't know where it goes. Are there any members who have any other questions? Okay, well then we're going to move on to the next measure, SB 3248, relating to ambulances. This appropriates funds to the Department of Health to purchase one advanced life support ambulance to be based on the island of Molokai and related equipment, and pay related personnel costs for state certified emergency medical services personnel. Department of Health with comments.
Yes, good afternoon, Chair and Vice Chair and members of the committee. This is Dr. Al Bronstein, head of VMS Injury Prevention, and for the Department of Health, and we will stand on our written testimony. Thank you very much.
Thank you, Mr. Bronstein. AMR in support.
So the way that they're entered into the system.
Okay, Queen Health Systems in support.
Hello, Chair. We'll stand in strong support of this measure. Thank you.
Thank you very much. That's all the live testimony we have registered. Is there anyone I missed? Okay, I'd like to note for the record, there are 2 individuals who submitted, testimony with comments, and 31 who submitted testimony in support. Members, any questions? Okay, we'll move to the last measure on the agenda, SB 2073 relating to telehealth. This allows for standard telephone contacts for telehealth purposes. First, we have the insurance commissioner.
Thank you, Chair, Vice Chair, members of the committee. Colin Hayashida, Insurance Commissioner for the Department of Commerce and Consumer Affairs. The department stands on its written testimony offering comments on this bill. Thank you, Chair.
Thank you very much. Department of Human Services.
Hi, good afternoon, Chair, Vice Chair, members of the committee. I'm Judy Moore-Peterson. I'm the MedQuest Administrator with the Department of Human Services. We stand on our written testimony offering comments. We are available for any questions. Thank you.
Thank you very much. University of Hawaii in support.
Aloha, Kelly with the University of Hawaii. We stand on our support.
Thank you very much. HMSA in opposition.
Good afternoon, Chair, Vice Chair, and members of the committee. My name is Lindsay Garcia on behalf of HMSA. HMSA does support telehealth and audio only as methods of healthcare delivery. However, we are opposed to this measure as written. Striking the exemption for standard telephone contacts from the definition of telehealth would require health plans to provide parity reimbursement for all audio-only visits. This would be essentially saying that a phone call from a provider, no matter how short or long, for any kind of healthcare issue is the same as seeing that provider in person or in a real-time audio-video telehealth visit. We do not believe that audio only always provides the same quality care outcomes as a real-time audio-video telehealth visit or in-person office visit. We would be open, however, to working with the legislature and stakeholders to more deeply discuss the nuances of telehealth and other modalities of care, perhaps in a formal working group established by the legislature. Thank you for the opportunity to testify. I'm available for any questions.
Thank you very much. Hawaii Pacific Health in support.
Good afternoon, Chair, Vice Chair. We'll stand at our written testimony in support.
Thank you very much. Hawaii Public Health Institute in support.
Not present, Chair.
Okay. Hawaii Primary Care Association in support.
Yes, hi, Eric Abe for the Hawaii Primary Care Association. You have our written testimony. I just want to stress 3 points. Medicare and by extension Medicaid implements telephonic telehealth as an interactive telecommunication system and applies it to all services that are already compensable under contract with some limitations. This change was made to the Medicare fee schedule and will stay in effect to the end of calendar year 2023. Under this regulation, audio-only communication technologies may be used for the diagnosis, evaluation, or treatment of mental health disorders furnished to established patients in their homes under certain circumstances. Thank you.
Thank you very much. Kaiser Permanente with comments.
Aloha, Chair, Vice Chair, Jonathan Ching for Kaiser Permanente. You have our written testimony offering comments. I certainly think that this bill, and we do support the intent, but as noted in some previous testifiers, we are not in favor of mandating that audio only should be paid at parity. I do think that this bill needs some further discussion, and we are certainly in support of continuing to work with all the stakeholders to try to find a solution that will equitably provide providers, especially in rural areas, with proper reimbursement. But we are opposed to a full parity. Thank you. We're available for any questions.
Thank you very much. Let me see. National Association of Social Workers.
Good afternoon, Senators. My name is Sonia Bigalki-Vannon. Thanks for the opportunity to testify. So we're in strong support of this bill. A lot of our practitioners are in rural areas or are on neighbor islands. I myself have a private practice on the North Shore of Oahu where I lose reception all the time. My internet goes down all the time. It's really important that we continue to be able to see our clients. This pandemic has fast forwarded telemedicine and behavioral health, 10 years. kind of beyond, where we would have been. And this legislation allows us to continue to build forward and to continue to plan for people who've gotten really comfortable with the idea of seeing someone virtually. We're not through the pandemic yet. We have older folks and vulnerable folks who don't want to come in for sessions and for services. And frankly, it's insulting the insinuations from the insurance companies that we would be seeing somebody for a portion of their session and trying to bill for the same. The question about parity is that it's still an hour of our time as a provider with our graduate degrees and our education and us as a healthcare provider. No one is going to bill for 5 minutes, and we still have to log our time. We still have to do our case notes, and we still have to do our paperwork that is submitted to the insurance companies. So really, it is an insult to have a comment that we bill for like a 5-minute phone call for the length of time of a 60-minute session. I mean, that's not realistic. And there is a paper trail to account for that. Our billing systems are robust. We bill to these insurance companies. They are the ones that see our documentation and our notes. So thank you for our time. And I just wanted to mention that the marriage and family therapists and psychologists had submitted to testify, and for some reason aren't able to get in right now. So they're also in strong support. We're part of the mental health we together. So thank you so much for your time, and I'm available for questions.
Thank you very much. Queens Health Systems in support or with comments?
Thanks, Chair. J.C. Michaelak on behalf of the Queens Health Systems, and we'll stand our written testimony supporting the intent of the measure, but having some of the same concerns that my colleagues from the other health plans and health systems have with regard to parity. Willing to work with all the stakeholders involved to continue to work on this. Thanks very much.
Thank you. Waianae Coast Comprehensive Health Center in support.
Dr. Stephen Bradley, the Chief Medical Officer here at the Waianae Coast Comprehensive Health Center. We stand in strong support of our written testimony. I just wanted to make a couple of comments. We support the Hawaii Primary Care Association's recommendations related to qualifying the telephonic visits, and that is full reimbursement can be considered if the telephone intervention is of a certain length and intensity, that there is full documentation in electronic medical records, and follow-up services such as care coordination, care enabling, etc., are offered in the visit. The important distinction for practitioners in rural and underserved areas with terrible broadband connectivity is that often televideo is not practicable for a number of reasons, both technically and attitudinally in the patients. And these are true visits. They're not just casual telephone calls. We do a full visit with all the armaments of our electronic medical records while we're on the phone with the patient. And we've seen that this has really saved the day, not only during the pandemic, but there are many patients, because of the circumstances in underserved areas, who cannot regularly come in for their follow-up visits to the clinic when they are the most needing of such. This is one modality that helps us through that. And lastly, I just want to mention that in areas such as Waianae, with the highest number of Native Hawaiians in the world, this is a health equity issue for Native Hawaiian population. Thank you very much. Aloha.
Thank you very much. Is there anyone else on the call or who has come onto the call who would like to testify on this measure? Okay, members, any questions? Okay, I'd like to note for the record, there were 23 individuals or organizations who offered supporting testimony, 2 in opposition, and 5 who offered comments. Yeah, I think, we may have some people who are trying to get onto the Zoom. I'm sorry about that. And since there are no questions, I'd like to recess on this hearing and go into decision making. So recess. Reconvening on this Wednesday, February 16th, 1 p.m. health agenda to consider measures heard at 1 p.m. The first measure is SB 2031 relating to the Office of Health Equity. The recommendation here is to add the suggested amendments from the Native Hawaiian Pacific Islander 3R COVID team. You know, it's basically specifically establishing the targets we would like the Health Equity Office to address. It also suggests we defect the effective date to January 1, 2050, and there are some technical non-substantive amendments. Members, any discussion? Okay, seeing none, Vice Chair, SB 2031 passing with amendments. Chair votes aye.
Vice Chair votes aye. Senator Moriwaki? You're muted. Senator Moriwaki?
Problem. Aye.
Thank you. Senator San Buenaventura?
Aye.
Senator Pavella? Thank you.
Aye.
Thank you. Chair, your recommendation's been adopted. 5
Thank
ayes.
you very much. Next measure is SB 3180. This is establishing a rural health task force around nursing. The recommendation here is to, we have some SMA amendments adding the Chapter 84 Ethics Code provisions for non-state employees who are members of the task force. Adding the Hawaii Primary Care Association suggested amendments, which place Malama Ikeola Health Center and Molokai Community Health Center onto the task force. And then as requested by DHS, removing DHS from the task force. I'm also going to recommend we defect the effective date so we can keep this going and further the discussion. Members, any comments or questions? Okay, seeing none, Vice Chair, SB 3180 passing with amendments. Chair votes aye.
Vice Chair votes aye. Of the other 3 members on the call, any objections or reservations? Hearing none, 5 ayes. Chair, your recommendation's adopted.
Thank you very much. Next measure, SB 3208. This is the preceptor bill. Recommend we move this out with technical amendments. Any discussion? Seeing none, Vice Chair, SB 3208 passing with amendments. Chair votes aye.
Vice Chair votes aye. Of the other 3 members on the call, any objections or reservations? Hearing none, 5 ayes. Chair, your recommendation's adopted.
Thank you very much. Next measure, SB 2128 relating to air pollution. All of the testimony on this measure was in opposition. There was no supportive testimony. So I'm going to recommend we defer the measure. The next measure, SB 3248 relating to ambulances. The recommendation here is to blank out the appropriation amount in the bill and defect the effective date to January 1, 2050. Any discussion?
Chair, you missed 2281.
Oh, I did. I'm sorry. Okay. Let's go back to 2281. Thank you. This is the school psychologist bill. You know, there are a lot of strong opinions on this measure, and I think both sides are still a ways away from each other. I would like to keep this measure moving with a defective date in the hopes that we can further the dialogue on this and move toward a solution that's actually going to work, because I think it's really necessary. So any discussion, moving with a defective date? Okay, seeing none, Vice Chair, SB 2281 passing with amendments. Chair votes aye.
Vice Chair votes aye. Of the other 3 members on the call, any objections or reservations? Hearing none, 5 ayes. Chair, your recommendation's adopted.
Thank you very much. Okay, so the next measure is the ambulance bill, SB 3248. Recommendation is to blank the appropriation amount and defect the effective date to January 1, 2050. Any discussion? Okay, seeing none, Vice Chair, SB 3248 passing with amendments. Chair votes aye.
Vice Chair votes aye. Of the other 3 members on the call, any objections or reservations? Hearing none, Chair, your recommendation's adopted. 5 ayes.
Thank you very much. Next bill is SB 2073 relating to telehealth. The recommendation here is to defect the effective date on this measure to January 1, 2050. Keep this bill moving. Any discussion? Okay, seeing none, Vice Chair, SB 2073 passing with amendments. Chair votes aye.
Vice Chair votes aye. Of the other 3 members on the call, any objections or reservations? Hearing none, 5 ayes. Chair, your recommendation's adopted.
Thank you very much. So we're going to adjourn this 1 p.m. Hearing agenda and open on our 1 p.m. decision-making agenda on SB 2443, which was deferred from a prior health committee hearing earlier in the week. This is relating to pharmacy benefit managers. There are a number of amendments I'm going to read off here, but essentially this is a measure that is attempting to address a number of antiquated sections of the statute. There were a lot of amendments, and I'm mostly just going to accept all of them because they just clean up the statute. The Department of Health amendments we're going to accept, clarifying the sort of archaic discretionary standards set in the statute currently. We're going to accept the clarifying amendments on fees from the insurance commissioner. We're going to accept the offered amendments from CVS, which do a number of things, including clarifying the disclosure of information to law enforcement specific to the complaint, and clarifying the cost share provisions in Section 2B, and also accepting the Kaiser suggested amendments referencing the definition of PBM in Chapter 431S for consistency. And there are also technical non-substantive amendments. And we'll go ahead and defect the effective date to January 1, 2050. Members, any discussion? Okay, seeing none, Vice Chair, SB 2443, passing with amendments. Chair votes aye.
Vice Chair votes aye. Of the other three members on the call, any objections or reservations? Hearing none, Chair, your recommendations adopted, 5 ayes.
Okay, members, that's our slate of Senate bills. Thank you very much for your help on this. We do have one more hearing on Friday to consider governor's message nominees. But aside from that, thank you very much again. We are adjourned.